And thank you for joining me today as we move our discussion from the upper body down to the lower body. So today we're going to look at the pelvis in particular. And so at the end of this video, you will be able to identify the three bones of the pelvis. You'll be able to label major features of the pelvic bones and provide at least three differences between a male pelvis and a female pelvis. Those are our objectives. So here we go. Your pelvis is made of three bones. One of them is called the ilium, one of them is called the ischium, and the other one's called the pubis. The ilium takes up the majority of your pelvis. So when you think of your hips, you're thinking of your ilium. There are a couple pieces to it. You have what's called your posterior superior iliac spine, your anterior superior iliac spine, and your iliac crest are your three main pieces of the ilium. Your ischium is the inferior, so the bottom portion and posterior portion of the pelvis. This is kind of your sits bone, the bone that you sit on. Ischium is made of your ischial spine and your ischial tuberosity, which is where your hamstrings attach to. And then you have your pubis, which is the inferior and anterior portion of the pelvis, which we will look at. Within the middle of your pelvis, you have this big hole. That is called the obturator foramen, and that is an absence of bone which makes our pelvis lighter. And then you have your acetabulum, which is your hip socket. This is where your femur attaches to your pelvis. And we're going to look at that as well. So for starters, here is your pelvis. The yellow segment is your ilium. On top you have your iliac crest. On the front side, you have your anterior superior iliac spine and your anterior inferior iliac spine. On the back, you have your posterior superior iliac spine and your posterior inferior iliac spine. In between your ilium, which is in yellow or gold, and your ischium, which is in blue, you have this large groove or inset here, which is known as your greater sciatic notch, which ends at this spike, which is known as your ischial spine, which then has another notch, not quite as prominent, so we call it the lesser sciatic notch, which runs down to your ischial tuberosity down at the bottom. The ischial tuberosity is a rough part of the ischium, which is found along what we call the ramus. So you have the ramus of the mandible, you have the ramus of the ischium as well. And then you have your pubis is the only thing left in red. And we have this little bump here called the pubic tubercle. And then in between your two halves of the pelvis is the pubic symphysis, which is a chunk of cartilage that connects your two halves of the pelvis together. The big hole here between your ischium and your pubis is known as your obturator foramen. And then you can't see the acetabulum on this one, but I'll show it to you here as well. So if we're looking at the pubis, we have a pelvic brim. This is the shape created by the pelvis and the sacrum. That is the start of the birth canal. The greater pelvis is the area above that, which is essentially your ilium. The lesser pelvis is inferior to your pelvic brim. And then you have your pubic arch. So this is your pubic brim, everything above that. So your ilium and maybe part of your pubis is part of the greater pelvis, and then down below that is your lesser pelvis, which is your ischium. But you will notice this is all here. You can see a little bit of your acetabulum on this side and on this side, but it's kind of hard to see in that diagram. If we're comparing male and female pelvises, you will notice that males have a more upright and vertical ilium on either side. These are more vertical. Females tend to flare out a little bit. Why? Because females have to carry a baby in between these two iliums. So it makes it easier if they are flared out. Your pelvic brim, in this case, is a little bit more round. So females is going to be more round, males is going to be more heart-shaped. And then your pubic arch, males is going to be narrower, females is going to be wider. Again, you're carrying a child. Here's a better picture of your acetabulum on both sides. And then this is your pubic symphysis as well in the middle, which is a band of cartilage. So some differences that you can note. Male pelvis has male pelvis has a narrower pubic arch, has a heart-shaped pelvic brim, is an upright ilium, and has a narrower sacrum and more medial posterior superior iliac spine. Your female pelvis is wider, flatter pubic arch, oval-shaped pelvic brim, a flared ilium, and a wider sacrum and more laterally placed posterior superior iliac spine. So those are some differences that you can use to recognize male and female pelvises. And you'll need to identify some of those on the assessment we have at the end of this unit. Here's another look at it. You notice the females is wider, males is narrower, more heart-shaped. This is narrower, this is wider, more flared, more upright there. Here are your review questions. What are the 3 bones of the pelvis? When you are told to put your hands on your hips, which bone are your hands resting on? Where is your femur attached to the pelvis? What connects the 2 halves of the pelvis? And give 3 examples of differences between a male pelvis and a female pelvis. Make sure you can do that. If you have questions, please come see me. Otherwise, I look forward to finishing up this unit and talking through the rest of the lower body with you. Enjoy the rest of your day, and I will see you next time.